Hi, my name is Dr. Jim McKenzie. I am a chiropractic neurologist, and today I'm going to talk about anxiety. So there's different causes for anxiety. There's a genetic predisposition that people can have. Usually that has to do with the receptor's ability to basically take in different neurotransmitters. Also, sometimes people don't have enough receptors for neurotransmitters, and that's the genetic component. Also, certain personality types are way more likely to develop anxiety. Also, if a person has stressors that last longer than 6 months and they have a certain amount of symptomatology, this is what we see with anxiety. And also, people that come from very, very strict households where the parents are very controlling, this is also another factor that we see that allows people to develop anxiety. Okay, so we talked about more than 6 months, and these are some of the symptoms that people get. So pounding or racing hearts, feeling jumpy or restless, trouble falling asleep or getting good night's rest. So sometimes people, they sleep, but they don't feel rested. This is really important, and this usually has to do with different neurotransmitters in the brain. Worrying about everyday decisions, avoiding certain places or things, focusing on bad versus good. So you're way more emphasized on negative thoughts rather than positive thoughts. A lot of times patients with anxiety, they use medications or they use alcohol or illegal drugs to basically help them manage. And this technically, anxiety along with depression, these are basically mood disorders which fall under the area of mental health. So the neurology of anxiety. We can see that patients with anxiety have inappropriate neurological signaling. There's an area of the brain called the periaqueductal gray area. This is the area that allows us to dampen pain using a neurotransmitter called serotonin. A lot of the patients that have anxiety, that periaqueductal gray area is not creating enough serotonin, and so they also a lot of times have chronic pain issues. But what's interesting is that sometimes you give them a drug for recycling serotonin, and all of a sudden it also helps with their anxiety because there is a connection there. Also, the hypothalamus, which is a part of your brain that allows for the regulation of hormones, oftentimes isn't working very well with people that have anxiety, and so their stress hormones can get way out of kilter, and this can make their symptoms worse. The amygdala, which is part of your limbic lobe, which is your emotional center of your brain, is also affected with anxiety. So some people have their amygdala is actually smaller, or it certainly doesn't fire at the right rate. The hippocampus, which is the part of your brain, one of the parts of your brain that's involved in your ability to learn or memorize information that's recent, is involved. So a lot of times people with anxiety also have issues with memory as well, and over time this area called the hippocampus, we see this area really not work very well with things like dementias and stuff. Also, the cingulate cortex and insular cortex are involved. We see these areas involved with empathy. So the parts of your brain that allow you to feel or experience somebody else's pain, these areas don't work very well with patients that have anxiety. And also, the interesting thing about this is that these areas, particularly the insular cortex, they have basically, we call it a viscerotopic map, where this part of your brain actually has organs mapped out on it, and if this area doesn't work very well, you could have abnormal feelings, in your gut, etc. We see that a lot with anxiety. And then the prefrontal cortex, which is involved in motor planning. So you may be less coordinated if this area doesn't work as well, and also your ability to plan tasks or to plan goals and stuff may not work as well for patients with anxiety. So there's different neurotransmitters that can be involved. We know that GABA, which is an inhibitory neurotransmitter, usually is lacking. Sometimes it can also be dopamine. Dopamine, it tends to be more with depression. The interesting thing, though, about anxiety and depression is that what I see in practice is that people that have depression usually also have anxiety, and usually anxiety starts before depression. But there's a lot of overlap between anxiety and depression. But also serotonin oftentimes is involved as people not having enough serotonin. So what's interesting about this particular neurotransmitter called GABA is that it allows you to relax. It helps moderate human growth hormone. It prevents seasickness. You do have some of it in your pancreas as well as your kidneys. They help make some of it, but the great majority of it is found in your brain itself. It is the #1 neurotransmitter that allows you to inhibit things that are working too hard. And with anxiety, we see that there's not enough inhibition going on. Certain areas are working way too hard that don't need to be. So the other interesting thing about, these are some other neurotransmitters involved. Cholecystokinin, this is a gut neurotransmitter that we see is dysregulated with people that have anxiety. There's another one called galanin. We see this dysregulated with people that have anxiety and depression, and this is basically a type of stress hormone. So this is dysregulation of your hypothalamic pituitary gut adrenal axis. Oxytocin is involved, and oxytocin is one of those hormones that allows a person to have an orgasm, but also it's involved in giving birth, and as well as a woman being able to breastfeed. So if a person has anxiety, it could even interfere with these types of functions. Also, vasopressin, which is an antidiuretic hormone made in your pituitary that regulates fluid balance, can be affected in this situation. And then there's also corticotropin releasing hormone. This affects your cortisol levels, and your cortisol levels affect your blood sugar, and your blood sugar affects hormones. So these are big deals, really. So what's interesting about, we're talking about the symptoms of anxiety. They're almost exactly represented by people that have low levels of GABA. So if a person has anxiety, they probably are going to have a GABA deficiency, but on top of that, they may also have serotonin deficiency or dopamine deficiency. So here we see, of course, anxiety, insomnia, depression, restless mind, disorganized attention, feeling of guilt about decisions, hard to relax, feelings of being overwhelmed for no reason. This can cause, actually these are some things that can affect GABA levels. So if your blood sugar is high or low all the time, that can affect your ability to make GABA as well as every other neurotransmitter. Alcohol, sometimes people have mitochondrial defects. Mitochondrial defects, your mitochondria you inherit from your mother. So if your mother has a lot of health issues, you're going to inherit her mitochondria. And so mitochondria are involved in basically being able to make energy, and if the parts of your brain that need to be able to make energy can't, this could be a genetic defect. So there's actually supplements that we can give you that stimulate those areas to work better. The one that I'm thinking of is called NeuroPTX. Also, barbiturates can affect GABA levels, having any kind of an anemia. And then the medications that are used to regulate GABA in the Western medicine is benzodiazepines and non-benzodiazepines. We classify them based on those two. Basically, those are the two titles that we use, and we can kind of break them down. So there's actually foods that can increase your GABA production. Peanuts, walnuts, hazelnuts, almonds, cheese, oats, barley, wheat. The interesting thing about wheat, though, is that wheat can cause anxiety, too, depending on your genetics. People of Northwest European heritage are way more likely to react to wheat. The closer you get to Ireland, the more likely you're going to react to wheat. But wheat, for some people, actually helps them make GABA. So it's very interesting a lot of times to figure out what people's ethnic backgrounds are, because it can affect your brain positively or negatively if you eat wheat. Rice, halibut, spinach, certain beans, as well as eating liver can help with GABA production. The supplement that I recommend for people to get GABA is called Gabatone. And it's basically a combination of valerian root extract, lithium, passion flower extract, L-theanine, and taurine. And more importantly, this also has certain cofactors for GABA to be made. It also has the receptor modulators, amino acid precursors. There's things that synergize that production, and then there's also catabolism inhibitors. What that means is that it prevents the breakdown of GABA. Just oral consumption of a GABA supplement or just those foods alone is usually not sufficient if a person is really deficient in that neurotransmitter. So it's not very easily absorbed orally. The supplement is, because it has all the different other things that you need to absorb it and to be able to help make your own. So if a person has too much insulin or not enough insulin, in other words, if your blood sugar tends to run high or tends to run low pretty consistently, and we like to look at labs to find this kind of stuff out, but what will happen is that you won't get enough blood, enough sugar into your blood cells, which causes decreased cyclic acid cycle activity, which and then we just see more symptomatology. And what's interesting about GABA, it totally codepends on glucose. So you can see that glucose becomes pyruvate, which becomes acetyl-CoA, and then it goes around in the citric acid cycle, and a byproduct is called alpha-ketoglutarate, which becomes glutamate, which is an excitatory neurotransmitter. We see this in excess levels, the glutamate, in people that are having seizures, or a lot of times people that have had concussions. But glutamate becomes GABA, and then from GABA there's an enzyme called GABA transaminase that allows it to go back into the cycle, and it constantly gets recycled like this. So the question is, how can we make a person make more of it so that their brain, the biochemistry of their brain, functions better? This is just another schematic, but what's interesting is that in order for us to have energy at all, whether it's energy in our brain or energy in our muscles, we have to have, GABA is important. And this does affect literally the mitochondria that we talked about earlier that you inherit from your mom. The ability for us to generate this energy, GABA is one of the things that we need. And of course, glucose and the regulation of blood sugar is very, very important. So what most people are taking for anxiety are SSRIs. These are basically trying to recycle the serotonin that you're not making. And they all have side effects and adverse reactions, and these are very commonly used. Paxil, Zoloft, Prozac, Celexa, Lexapro. Basically, these are not just used for anxiety, they're also used for depression, OCD, eating disorders, chronic pain, and IBS. But what's interesting is that if you know that this medication works for you, then you already know that you don't have enough serotonin. So instead of just trying to recycle a little bit that you have to try to help you function, the goal for my patients that I have for them is to help them make more serotonin and not have to need something to recycle it. And then, there's the benzodiazepines try to regulate your GABA, try to upregulate it. And the medications that people are taking for this are Xanax. There you can just see them. They're all listed here. Valium is one of them. And again, this is just a sign that you really don't have enough GABA. And here's some more drugs that help regulate your GABA. Common ones that I see with my patients, Ambien is very, very common. A lot of people are taking it. So at our clinic, the way that we treat anxiety is, first of all, we like to get a very good history, and that's going to give us a lot of information. You know, how many times has a person been injured? Have you had a concussion before? These kind of things can affect, you know, anxiety, because if your brain's been injured, then it changes the biochemistry of your brain, as well as the axons in your brain itself. We also like to get blood work. So if you've had recent blood work, bring it in. I like to see anything that's within the last year. That's very useful. And then a lot of times I like to order other blood work, depending on, you know, how thorough your clinician was in the last labs that you had. But if we can figure out, a lot of times, remember what I was saying about blood sugar being involved in your ability to make the different neurotransmitters. It's good to do a fasting blood sugar, as well as if it looks like you have symptoms of hyperglycemia or prediabetes or diabetic, it's good to do a hemoglobin A1C as well. We have our patients fill out a neurotransmitter assessment form. That helps us get an idea of what's happening in the biochemistry of the brain itself. We like to figure out if your hypothalamus isn't working very well as far as how it's communicating to the adrenal glands. We like to figure out, is there swelling and inflammation in your brain? Is your brain not getting enough nutrients like DHA? Is the mitochondria not getting enough stimulation? And then we like to look at which neurotransmitters are involved, so that we can try to figure out what the right supplement to give you is. We also have our patients fill out the brain region localization form. This helps us figure out, based on your symptoms that you're aware of and how you perceive yourself, what part of your brain should we target. And we actually have a way of scoring everything so we can figure out the priorities. But we don't want to just look at that. We actually, we also have ways of testing all this stuff. So this is subjective stuff. We like to compare that to actual objective findings. So we are going to, on this very screen that you're looking at, we're going to have something called CNS vital signs. We look at hand-to-eye coordination, and this helps us figure out neurocognitively what's going on in your brain. And actually, this is used by the Mayo Clinic. This is used at various medical schools all over the world. And it's a very good way of getting an idea. Based on how you perform, it can tell us, is a person most likely have anxiety? What about depression? What about, have they had a concussion? It gives us a lot of very, very interesting information. Then what we do is, after you've done that, we actually measure your brainwave activity. We have a quantitative EEG, so we measure alpha, beta, theta, gamma, and delta waves. And based on that pattern, we can figure out what your asymmetries are and what most likely does the patient have. If it looks like they have anxiety, we can usually see this kind of stuff when we look at brainwave activity. What's even more important is we can do something called neurofeedback. So once we know what your abnormal brainwave activity is, we can actually hook you up to a device that changes your brainwave activity. We call this neurofeedback. So if we're giving you the right nutrients for your brain, and we're going after the right neural pathways based on a good exam, and if we are giving you the right stimulation and your blood sugar are being regulated via either exercise, diet, or supplementation, or even medications, then we have a much better level of success, because we can create long-term changes rather than just symptom management. We also have what's called the neurosensory integrator, which is this screen again that you're looking at. And we have all kinds of different exercise programs where we can actually rehab different kinds of conditions by stimulating the brain in various ways. And we can actually graph out your improvement. So if you're getting better, we can measure that and graph it out. We talked about supplements earlier. There are diet you know, with our patients, we like to give them diet. I have to do some diet modifications, and also somatic exercises like going for walks and things. Also, we are creating a special protocol for various kinds of brain conditions. So on top of the other things that I just talked about, we'll have people maybe bouncing a ball with their left hand with their eyes closed, or different things like that that we're going to do to try to create more symmetry in a person's brain. So we're going to combine different things in combination, and we're going to do pre and post testing to make sure that it's working. And I don't see any reason why people have to have anxiety or depression. I think mood disorders are very easy to help. So that's about it. And if you have any questions, feel free to give our clinic a call. And you have all the information up here, or you can also send us an email. But anyway, we're in the business of maximizing the function of people's brains. And so that's the idea. So anyway, feel free to contact us.